I remarried 5 years ago, and since that time I have been commuting from just outside the Charlotte area. For 5 years I come in and work 3 days a week. And over the last year, my son has graduated and moved away, my daughter's graduated and moved away, and my mother has passed away. So I felt like the only thing holding me in the Raleigh area is Wellington. And as much as I love it, it's time for me to move on with my life and retire and start the next phase of my life. And when I decided to list the practice for sale, the broker that I used introduced me to CareFirst as an option. And I have to say, it was one of my first options. I was very pleased with the possibility because of my relationship with Dr. Joe and with the philosophy of his business style. And I thought it would be a good fit. Plus, it would give my staff the ability to stay, which was a concern of mine. I wanted to have consistency with my doctors and my staff because most of my staff had been with me 10 plus years, and that was very important to me.
I had just started to list the practice, and when I learned that it was Wellington Animal Hospital was an option with Dr. Edwards, it was really easy to say that will be a good blend, again because of the respect and the knowledge that I have for Dr. Edwards and the practice, the excellent practice that she has built here, and the goal of helping to carry on her legacy as the founder of Wellington Animal Hospital. Tagline for CareFirst Animal Hospital has long been, "It begins with caring," and to me that phrase has just a wide spectrum of meaning. Obviously we care for our patients and our clients, and we care for our team, and we care for our community, we care for the animal rescue groups. And so I frequently do a session with the team when we talk about who do we care for, and those types of names come up, those groups or stakeholders, and then the next question is how do we care for them? And we care for our patients and our clients by being able to provide the best quality medicine possible, and by being a group of hospitals we're able to capitalize on that in the purchase of equipment and supplies that provide us with the ability to provide better care for our patients. We're one of the first practices to bring in digital radiography to the private practice world. That's been almost a decade now. We've brought in laparoscopic procedures to all the practices, and that's a type of procedure that allows our patients to recover more quickly from a surgical procedure if that technique is appropriate to use.
It's important for me to have them understand that they are going to be taken care of. They're not going to lose their job. If anything, they are going to have much better benefits because it is a larger group that can offer better benefits. They are going to have more opportunities for continuing education. They're going to have more support staff. I think in the long run, by being part of a larger organization, it's going to be so much better for them, and it's a win-win situation for everybody.
They are the most important asset that we have here at Wellington. The team is what makes Wellington successful, and we want to build on that success that's already been here.
That I appreciate them. Some of my clients have been with me 17 plus years from my other hospital, and I am so appreciative for their support and their love all these years. I've been through several generations of family members, and I can't thank them enough, and I wanted to be sure they were left in good hands, and that they would continue to get the same care and service and love that we've given them over these years.
We certainly honor her legacy and her relationship with her clients and her patients, and we want to continue that to make this transition as seamless as possible for them and for them to know that we are going to be here to provide the best care possible for their pets.